Hi, I'm Eric Wilkinson, and I am one of the 4 therapists in UK's Office of Work Life and Workplace Life Connections. And today I'm going to do a presentation on how to know if your child needs to see a therapist. So I'd first like to just start with some warning signs that your child may be experiencing some difficulty. If you notice some of these behaviors or some of these signs in your child, then there's a possibility there may be some mental health issues, some emotional problems, or they may just be going through a difficult time and could use some additional support. So some of the warning signs of potential mental health problems are if there's persistent sadness, particularly if this is 2 or more weeks. So we know that all people, including children, have moments of sadness, they have sad days. But if you see every day your child appears sad, particularly if it's longer than a couple weeks, then this would be indication of some mental health concerns. If your child starts to withdraw or avoid social interactions, this can include not wanting to participate in family activities. It could include not wanting to see friends, not wanting to go out in public. If your child or teenager hurts themselves or talks about hurting themselves, so this could range from self-harming behaviors could include a younger child or a school-age child banging their head on the wall. It could include somebody that cuts on themselves if they're feeling distressed, or makes burn marks on their arms. It could also be if your child is talking about that they hate themselves and they're going to do something to injure themselves, which leads to the next point. If they talk about wanting to be dead, or if they talk about wanting to kill themselves, those are definitely some indications of mental health concerns. In my many years of working with children and families, I've seen children as young as the age of 5 say, "I wish I was dead," or "I'm just going to kill myself." And while a lot of times it's easy to just chalk that up to, oh, they're frustrated or mad, if you're hearing language like that from your child, then there's probably some emotional health or mental health issues at play. If you see an increase in irritability or a lot of outbursts or tantrums, if you see out of control behavior that might be harmful, that could be increased risk taking, like they're doing illegal drugs, staying out all night, engaging in unsafe sexual behaviors. If you just see a lot of out of control, risk-taking behaviors, or if they're getting in fights, those are concerns. If there's significant changes in mood, behavior, or personality. So if your child just doesn't seem like they're their normal self, they're suddenly acting in a very, maybe normally they're calm and now they're exhibiting explosive or aggressive behaviors. Maybe in the past they were introverted and now all of a sudden they're talking nonstop and really outgoing. Maybe they tend to be a child that goes with the flow and now they seem to get frustrated all the time. I do want to just note that, of course, mood swings are very common and developmentally normal in adolescence. So we're not talking about like the normal kind of teenage blues or teenage issues of irritability where somebody's had a bad day. We're talking about this is more pervasive, where you've seen a significant change in either mood, behavior, or personality that, again, is taking place kind of, multiple days in a row. If there's changes in eating habits, which could be restricting what they're eating, or just a radical change in how often they're eating. Sometimes it could be that you see a significant increase in how often they're eating or how much junk food they're eating. If you see loss of weight, or you've noticed that there's been problems with sleeping, there is a sleep epidemic where a lot of children, particularly teenagers, do not get sufficient sleep. But we also know that when kids are having difficult times with anxiety or depression, that can interfere with sleep. If your child starts to complain about headaches or stomach aches, these somatic concerns are often indication that there may be some emotional problems or there may be some mental health issues. If compared to what's normal for your child if they're having a really difficult time concentrating. This could be a concern. And then finally, if you see significant changes in their grades, or if they're avoiding school, refusing to do schoolwork, these also can be warning signs. Some resources that are always available on the internet you can consult. First of all, I highly recommend looking at the CDC's developmental milestones, which they break them down by age. I mentioned earlier that a lot of times parents will be concerned about minor mood swings for their teenagers. And again, that's pretty normal. By checking out the developmental milestones, you can kind of assess, is what my child is exhibiting, is that within the normative range? Do other kids exhibit this? Is this, we often talk about physical growth spurts. Well, there's also emotional growth spurts. And so that's a great resource to come back to and just to kind of see, is what my child is exhibiting, is this fall within the normative range? I also included a link to the Mayo Clinic, which has a nice overview of mental illness in children, both in terms of the prevalence of mental illness and how it's changed over time. I've used a lot of their resources for this presentation. Okay, so if you do have concerns, if you are seeing some of these behaviors that I just provided an overview, then a first person of contact can often be your child's doctor, your child's pediatrician. Just sharing with them, these are things I've noticed in my child. I'm kind of concerned. Should I seek help? What do you think's going on? So it's a great source, your child's pediatrician, in terms of checking in with them. Also, your child's, people at the school, the teachers, the school counselors, school social workers, they are often really tuned into whether or not your child's behaviors are causing them problems in terms of making friends, in terms of classroom behavior. So they're going to see your child under different stress situations, in different social environments than you see them in. And so sometimes you'll see kids that are having a difficult relationship with a sibling. This happens a lot when kids are 1 or 2 years apart. They're fighting all the time. And so the parents worry, oh, my child must have something wrong with them. And then they talk with their teachers and school counselors, and they realize that the kids get along great with other kids at school, and they regulate their emotions at school, and they're doing well. It changes your perspective. So great source of information. Also schools, a lot of schools, I know in Fayette County, schools partner with community-based mental health organizations so that they can provide counseling to school-age children. And so this is a partnership. It happens in Fayette County. I know that these type of partnerships are in a lot of surrounding counties in different parts of the state. So just asking what kind of resources are available. There's always kind of the built-in resources, which is the school counselor, school social worker. But again, there's been a real proliferation of these partnerships with community-based mental health organizations that can deliver services to children in the school setting. A great source or a great support is just talking to other parents, to your family, to your friends. Asking them, have you seen these behaviors in your child? Sharing with them some of the stresses or challenges, and just kind of using them as a sounding board. And then anytime you have any elevated concerns, it never hurts to consult with a behavioral health professional. They can do a formal assessment and just kind of check in to see how your child is doing. And so again, behavioral health professionals, you can access them often through schools. Within UK, there's the adolescent clinic, there's a pediatric clinic. There's also, of course, work-life therapists. I work with a lot of families and children. Increasingly, there are behavioral health professionals within primary care settings as well, as healthcare becomes more integrated. So if you don't know where to start, you can always talk to your school counselor, school social worker, ask them for some referrals. And you can also always reach out to Work-Life Connections and schedule with us. I think it's helpful to look through kind of the developmental stages that children go through in terms of their social skills and independent living skills, just to see is what my child is exhibiting, does this fall within normative range? Is my child progressing consistent with their age? So this slide shows 3 to 6 year olds. You know, during this time, you start to see some independence, ability to address oneself, pick up toys. Children often model the behaviors that they see in either parents or siblings, starting to learn to take turns. Kids start during this age range to start to play together instead of just doing parallel play when they're next to each other. And there's starts to be growth in creativity and imagination. Communication improves, and you see some simple reasoning skills. Kids during this stage are still very egocentric. They often have magical thinking about the world. I think things happen because of them, even events in the world that have nothing to do with them, and that's normal. So when you're looking at your child, if they're in this age range, they should be showing these kind of developmental milestones. If you're seeing several of these things, if several of these things are absent, that might be a reason to talk to your school counselor, school social worker, school teacher, or pediatrician. This is a slide for children between the ages of 6 and 12. There's greater independence, more complex household chores. A big part of this developmental stage is learning how to negotiate with their peers, to work within a group, to be part of a team, participating in organized activities, which can include clubs, sports. You also see that you start to get more differentiation in terms of interests and hobbies. So children start to figure out, what do I like? What interests me? What kind of activities do I enjoy? There's increased completion of homework during this developmental stage. Problem-solving skills improve. There's greater capacity for delaying gratification, for planning ahead. And there's a much enhanced sense of what is culturally understood as right or wrong. So especially around the age of 9 or 10, children in that age are really interested in games with rules and people following the rules. Part of that developmentally is just internalizing the cultural norms of what is seen as right and what is seen as wrong within their culture. This slide is for 12 to 18-year-olds. We see this stage is about preparing for adulthood and independence. There's search for identity is really central. So this is where I mentioned earlier that sometimes change in mood and behavior, personality, it can be a sign of mental illness, but also, again, it's normative, particularly for teenagers, to try on different styles of clothing, listen to different music. Essentially, they're exploring their identity. And as long as it's not causing major impairment in their social relationships or in school, as long as it's not unsafe, it's very normal and actually very healthy. During this stage, you see children, it's important to master personal hygiene. Anyone that's had a teenager has had that conversation about bathing consistently and using deodorant. Kids at this age start to learn how to manage conflict when it arises with peers or with adults, how to respond to peer pressure. Increasingly, kids between ages of 12 or 18, their real focus at this developmental stage is their peer group, much more than their family, and so they increasingly participate in activities outside of the family. You will see independence represented through learning to cook, to budget, to obtain and work a job, learning to drive a car. This is an age when people often will start to date or become interested in romantic partners. And there's also a development of more abstract and critical thinking. 12 to 18-year-olds are highly idealistic, and this is a time where they tend to be very critical of what they see as wrong in the world. Sometimes that gets directed towards parents. Just know that is normal, and that's part of them developing their belief system about the world. All right, so those are kind of like the normal developmental milestones. Now, I'm going to just give a brief overview over the most common mental health problems. I'm going to start with anxiety disorders. Anxiety disorders are when children have persistent fears, worries, or anxiety that interrupt or disrupt their ability to participate in play, school, or age-appropriate social situations. Some diagnoses include social anxiety, generalized anxiety, and obsessive compulsive disorder. Let me just say, for any kind of mental health problem, one of the things you always want to look at is, again, it's all human beings experience anxiety. That's part of being human. So you have to ask yourself, is this causing some significant impairment? Is it interfering with their relationships with friends? Is it interfering with their ability to be successful in school? You want to know, is it disrupting their functioning in the world? So about 7% of children between the ages of 3 and 17 are diagnosed with anxiety. Anxiety has been increasing in children and adolescents over the past 20 years. I think this is a really important point. 40% of children and adolescents who have anxiety problems don't receive treatment. So we do know that not everyone that has, a lot of times anxiety can manifest as an internalizing disorder, where kids really just worry, they have interference with sleep, they feel really stressed out. That may not present as behavior problems. It may not be something that they openly communicate to parents or to teachers. It may be very much in their own head. So sometimes it's hard unless you're checking in with your children about how are you feeling, how are you doing. Unless you're really paying attention, sometimes often anxiety problems can be overlooked because they can be internalizing. And then even when people do recognize that there's some anxiety, many times children do not receive the treatment 40% of the time. ADHD, compared, this is important, this opening line is really important. Compared with children of the same age, I stress that line because we know that all younger children tend to have a lot more energy. They tend to be a lot more impulsive because they haven't had a lot of frontal brain development. So that opening line is a point of emphasis. Compared with most children of the same age, children with ADHD have difficulty with attention, impulsive behaviors, hyperactivity, or some combination of these problems. It is estimated that a little over 9% of children between the ages of 2 and 17 have received an ADHD diagnosis. I would like to note that Kentucky has the highest rate of ADHD diagnoses in the nation, almost 15%. And so a lot of times what could be some other kind of mental health issue is misdiagnosed as ADHD. So for example, if a child has a lot of anxiety, they may be struggling with paying attention in a classroom. They may have difficulty following directions. This inattentiveness could be misdiagnosed as ADHD. With kids that have post-traumatic stress disorder or have had some complex trauma exposures in their life, a lot of times there's a lot of hypervigilance where you're looking around for danger. Again, this makes it hard to concentrate and pay attention. It also can look like kind of real hyperactive behavior because they're kind of always fidgety and moving. So it's really important, if there are concerns, that you have, that you consult with a physician, with a pediatrician. And then if you do a formal assessment, make sure that the person that's assessing your child actually has been trained to do assessment for ADHD. Another very common problem in children and adolescents is depression and other mood disorders. So depression is the persistent feeling of sadness and loss of interest that disrupts a child's ability to function in school and interact with others. Again, everybody has days when they feel sad. Everybody has days when they feel low. If it's occurring day after day, if it's interfering with their ability to socialize with others, to participate in family activities, if it's interfering with their sleep, if it's causing problems with their learning at school, this is when it starts to move more in the area of clinical depression. Bipolar disorder is where you have extreme mood swings between depression and then also in mania, where you have extreme emotional or behavioral highs that can be unguarded, risky, or unsafe. The rate of bipolar in children is very low. When you do see some bipolar symptoms, it tends to be later in adolescence. So about 3%, a little over 3% of children have been diagnosed with depression. And in the course of their life, in the course of your childhood, that bumps up to about 5%. That was as of 2012. Okay, let's see. One of the things I would stress for depression is that if you really see that your child is having difficulty enjoying things, If the things that they used to like doing, like playing sports, spending time with friends, if they just don't enjoy these things anymore, that's a real strong indicator of depression. Also, depression often manifests different in children than it does in adults. With adults, you see a lot more wanting to stay in bed, just lay around, sleep a lot. With children, there's a lot more irritability. So if you see a real increase in anger and irritability in your child, that may be a sign of depression. Age of onset, this is just a graph that lets you know for these disorders when they're most likely to present. So if you look for depression, you hardly ever see clinical depression in kids under the age of 5. It's really low rate, but 6 to 11, you see it jumps up to about 2%. And then there's a real spike in adolescence up to about 6%. You look at anxiety, anxiety compared to depression is more prevalent in children under the age of 5, but it's still pretty low. It's still under 2%. If you look for 6 to 11, you see an increase to over 6%. And then you see a real high spike for anxiety for adolescents between the ages of 12 and 17. And then behavioral disorders, this uncovers a wide range. It would uncover disruptive behaviors that are associated with ADHD. Could also include if your child is doing unsafe behaviors, breaking the law, getting into fights. So behavior disorders is a wide-ranging category. But again, you see behavior disorders, they're more than anxiety and depression. You see more of them in kids under the age of 5. It's about 4%. And then you see a big jump for school age years between 6 and 11. A slight decrease, but still it's about 8% of kids between the ages of 12 and 17. So this just lets you know, these are, different ages when kids are more vulnerable to having some of these mental health concerns. I also want to just look at specifically post-traumatic stress disorder. First, in order to have post-traumatic stress disorder, you have to have exposure to trauma. So over on the left, you see that what does exposure to trauma mean? It means that you either directly experienced something that was traumatic, something that was threatening to the safety of somebody or threatening to their sense of self. So witnessing, directly experiencing it is actually where you would have the traumatic event is like happens to the child. So this could be a child who is physically abused, sexually assaulted, in a serious car accident, present for a school shooting. So these would be direct contact with trauma. A second type of exposure is where you witness it. So you see it happen to others. So seeing somebody close to you that you care get assaulted or sexually assaulted, physically assaulted, witnessing domestic violence, again, witnessing violence within the community, even if you witness a terrible car accident that you're not part of, this would be witnessing trauma. A third type of exposure is that you learn that someone close to you experienced or was threatened by a traumatic event. So it could be that hearing that your father, when he was coming out of a grocery store, somebody robbed him and put a gun to him. It could be learning that that somebody at school that you're friends with was after school, a group of kids jumped them and beat them up. It could be learning that that someone that you love was sexually assaulted. So this is where you exposure through learning about traumatic event that occurred to someone you're close to. And then a fourth type of exposure is where you learn about graphic details of a traumatic event, kind of like repeatedly. So this could be repeatedly hearing the graphic details like around the 9/11 and the events with the planes flying. It could be hearing a lot of details about a school shooting, lots of media coverage. So if you're repeatedly exposed to these graphic details, that can also be a trauma exposure. Underneath that, it's estimated that 5% of adolescents had PTSD. and about 1.5% are severely impaired by their PTSD. We also see that females are more vulnerable to PTSD. About 8% of adolescent females meet criteria for PTSD, and about 2.3% of males do. Over on the right, what are the symptoms of PTSD? This is where people continue to relive the event over and over, either in their thoughts, so they just keep ruminating, thinking about it, or in their play. With younger children, a lot of times you'll see they will keep playing the traumatic event out. It could be with toys, it could just be in like imaginative play, but you see this reliving, re-experiencing the event through thought or play. It also can be where you re-experience it in nightmares. So you continue to have bad dreams about the traumatic event. A symptom also, of course, because of this can be poor sleep or interrupted sleep. Becoming very upset when something causes memories of the event. So sometimes visiting a place that reminded the child of the event, of the trauma, that could be triggering. Seeing a person that resembled like a perpetrator can be triggering. Sometimes even sounds or songs, or like sometimes a certain cologne or perfume can be triggering. So just becoming very upset when something in the environment causes memories of the event. Lack of positive emotions. A lot of times with kids with PTSD, you just see they're no longer smiling, laughing. There's just an absence of positive emotions. A real intense fear or sadness. So just really, really sad, really, really scared. Irritability and anger outbursts often increase. You see this a lot where there's constantly this hypervigilance, looking for threats. So kind of looking over their shoulder, looking for danger, having to sit in a restaurant where their back is against the wall, being easily startled by random noises or loud noises, that real strong startle response or jump response. If kids start to act helpless, hopeless, or withdrawn, where they feel like the world's unsafe and there's nothing they can do about it, they just kind of withdraw into themselves, isolate themselves. Also, sometimes you see this kind of denying that the event ever happened, or just feeling emotionally numb. So that's a real strong form of avoidance. It could also be because they dissociated during the event. And then, as mentioned or kind of referenced earlier, the idea of avoiding places or people that were associated with the event. For some children that have experienced trauma, even seeing a police car or hearing a police siren or hearing an ambulance can be a trauma trigger. Okay, so that's the prevalence of kind of like the most common mental health concerns and disorders, kind of what they entail. If you are seeing signs of, I'm going to just go back real quick to this list. If you're seeing signs of anxiety disorders, if you're seeing signs of ADHD symptoms where there's a lot of hyperactivity, a lot of difficulty with attention, again, compared to other children their age. If you're seeing signs of depression, which sometimes manifests as, just extreme sadness, it can also in children manifest as irritability and anger. If you're seeing signs of trauma, the symptoms we just went through, those are all times where I would strongly encourage you to consider either consulting with a behavioral professional or at a minimum talking to your pediatrician and to supportive school staff. As I said earlier, I am one of 4 therapists, so we do offer 5 free counseling sessions per fiscal year, which is for UK staff and faculty, as well as their spouses and dependents, including children. So we do work with a lot of children. We're able to do evidence-based mental health screening and assessment. I would like to now shift to some questions that were posed or submitted by participants when we first did this, first offered this workshop. One question is, if our child is not on UK health insurance, can you still work with them? The answer is, if you are UK staff or faculty, if your child is a dependent, the answer is absolutely yes. You don't have to have UK health insurance to work with one of the therapists in Work-Life Connections. Another question is, will you clarify fiscal year regarding the 5 free sessions? So the fiscal year runs from July 1st through June 30th. Every year, those 5 free sessions are renewed. So each year there's a new additional 5 free sessions. Here's another question that says, can the current pandemic situation cause PTSD in kids? We haven't been sick and my kids don't know anyone who's died, but I wonder if my daughter's anxiety is related to PTSD. So again, it's important to talk with kids about what's happening in the world and to give them age-appropriate information. But if kids are hearing getting repeated media exposures about, graphic details of what it's like for patients that have COVID-19 when they are on a ventilator or they can't breathe, if they get a lot of media exposure to some of the emergency room doctors and nurses that are talking about their hospitals being overwhelmed and not enough hospital beds, not enough doctors and nurses. If they get a lot of exposure to talks about just the high volume of people dying, then that type of exposure potentially could trigger PTSD. If there's a general sense of a lot of exposure as well as a sense of things being unsafe. So it's important to talk with your kids, not only about, yes, there is a pandemic, but also just give them, again, age-appropriate information about who is most at risk. Generally speaking, kids are at lower risk for serious complications than adults. And people that are not seniors are at lower risk than seniors. But also letting them know that really emphasizing the things that are within your control. So the things that you're doing to keep the children safe and their family safe, things like physically distancing, washing hands, wearing a mask, explaining to them this is why a lot of schools are doing virtual learning. So there are things that we're within our control. And it's helpful that if your kids are watching the news, to watch the news with them. There are I know NPR has like a children's news program where it's age appropriate. And finally, just limiting their media exposure. Really, just like for adults, too much media exposure it can cause a lot of anxiety, and in rare cases could cause PTSD. So making sure your children are informed and they're aware of what's going on, but really limiting their exposure. So it may be something, I remember hearing that President Obama with his family, he would watch 60 Minutes with his family, with Michelle Obama and with their children. And that was like, that's kind of like a nice way to check in on what's going on in the world as a family, have accurate information, and you're not getting the constant daily exposure. I'm just using that as an example of how you could limit media exposure. There's another question that says, how do you differentiate between depression and a lack of enthusiasm due to online school and a non-existent social life for teenagers? It's a great question. I mentioned earlier, depression often presents as low energy, irritability, anger, lack of pleasure in activities. If you, as I stated before, if you see that this intense sadness is a daily event that has been present for more than 2 weeks, and if you see that even when they're not doing things like, if they are basically showing that they find very little joy in their lives, if things that they used to like to do, like riding a bike or shooting basketball, playing video games, watching Netflix, if these things are no longer things that they are doing or no longer enjoying doing, that would be a sign of depression. I do think that in general, virtual learning is difficult for a lot of kids, and also physical distancing is difficult for children and adults. And so knowing that that's going to impact mood, when it moves into this really intense, pervasive sadness, lack of joy, that's certainly a time where you would want to consult with a behavioral health professional. I have another question that asks, we have a pediatric appointment for a 6-year-old. I have some questions about their behavior and some of their attention issues. Do you have advice about how much to say while my child is in the room with the doctor? So I mentioned this when I did this workshop originally, there are evidence-based assessments that are in the public domain, meaning you can download them online. One is the Vanderbilt assessment, and so you can answer questions as a parent, just documenting your child's behaviors. You can take that into your primary care physician. There's also American Psychiatric Association has some mental health screening for ADHD that you can do. So that's one way to share information with your doctor without having to, and it's evidence-based screening without having to go into prolonged detailing. But what I would say is that it's okay to talk with your child present, but what I would do is you want to make sure that you're emphasizing what situations have been challenging, what's difficult for your child. Maybe it's when you give them a series of instructions that are more than one or two steps. Maybe it's difficult just in terms of when you're reading a book together, they seem distracted. Maybe it's that they're losing, they have a very difficult time organizing their materials. They're constantly losing things. Being able to kind of describe the behaviors in a neutral way that is not criticizing the child, not criticizing their character, not saying they're lazy, saying that, that they're, I'm trying to think of, kind of be using neutral language that is behaviorally specific. That is a way to communicate. Another question is, my son is very negative. He always says things like, that will never happen to me, or I never get picked. It often brings him to tears. So there's a lot of negative thinking about not getting picked for social events. Anytime we correct his behavior, he falls apart. So he's sensitive to criticism. Is this an example of depression? He saw a behavioral health professional in second grade. This was a teacher's request. She focused a lot on growth mentality. It's okay to fail. I'm not sure if we need to continue to seek help with him. If you see a lot of crying, a lot of, multiple days a week or daily crying, that's usually a concern that you probably want to consult with a behavioral health professional. Also, just if you see avoidance of trying new things because there's fear of failure, if that becomes very, very pervasive, that would also be a concern and a reason to see a behavioral health professional. And if you just see a lot of negative self-talk, one of the things, evidence-based practice for depression is cognitive behavioral therapy. There's other evidence-based practices. I do a lot of mindful self-compassion. These, both cognitive behavioral therapy, particularly the cognitive work, as well as the mindful self-compassion. A therapist that has a background can work with a child in helping them to think in a more flexible way, to be kinder towards themselves and how they talk to themselves. And so I think if you're seeing these patterns, I would recommend consulting with a professional. I have another question that says, my grandchild, who's the oldest, has been constantly, well, let's say not raised the right way. Her mom has major anxiety, anger, and PTSD. I don't feel like my son and her mom abuse her, but they don't treat her the same as they do their baby. I've worried about her since she was a baby. She is now 9, and she's never stayed with friends, or they don't really go outside. I worry about her. So as I mentioned when I originally did this presentation, if you have a parent who has post-traumatic stress disorder or severe anxiety or severe depression, this does make the child a lot more at risk for their own mental health problems. And the reason is because, particularly when a child is young, the emotional state, the way that they map out the world, make sense of the world, is highly dependent on the emotional state of their parent and the way their parent views the world and talks about the world. So if the parent is always on edge, always fearful that something bad is about to happen, if the parent talks about the world, views the world as unsafe, as dangerous, if the parent shows a lot of emotional instability, a lot of anger outbursts, that child is likely going to develop feelings of anxiety, concerns that the world is unsafe. And so yes, that can certainly impact the child. And a child who is showing fear of being outside of the home, staying with friends, playing with kids outside, especially at the age of 9, that would also be a concern. So what I would say is that I would recommend, trying to find some support for this child either through a school setting or a community setting, recognizing that the child has needs and they could probably benefit from a behavioral health professional. I have a question here that says, any tips on procrastination for an 8-year-old? He puts a lot of energy into avoiding schoolwork. When we sit and talk with him, he seems to get why schoolwork is important and why we're doing it, but the next day it's back to the procrastination. One of the things, what I would really stress is that for 8-year-olds, their attention span is fairly short, just developmentally speaking. I would try to really chunk the work and celebrate small successes. You know, let's do like 15 minutes and then let's do a movement break. Providing incentives as well as, like, you know, if you can knock out a few of these activities, then you can play 20 minutes of your video games, or we'll go outside and shoot some baskets. So I love giving, I strongly recommend giving movement breaks. I also recommend breaking work into small pieces, celebrating every time you complete like 10 minutes or 15 minutes of work. High five, well done, that was really good, encouraging. Sometimes it can help. I made the point, I've seen this be effective to provide, you know, have like a blank board or something you can write on, where you document every time he or she completes something, you write down what they've done, so you're celebrating your successes as you go, which can build a sense of momentum. And then figuring out, like, what is there, if your child can work for 15 minutes, take a 10 or 20 minute break, work for another 15 minutes, kind of recognizing when, you know, what is their threshold. And over time, you want to kind of push them a little bit, but you also want to be supportive of them when they need some downtime. So that's kind of, those are some techniques. It's really about, like, the skills that you're teaching. Just know this, the skills you're teaching your child at 8 years old, the same type of self-motivation skills that he's going to need to use when he's an adult. And so it's not easy. We all have times where we struggle with motivation, or we avoid things we don't want to do. And so learning to do some of these things, to give yourself small breaks, little rewards, to use movement, and to take work and chunk it into smaller doses, those are things that can be helpful. I have a question here that says, what do you think about the long-term effects of the pandemic and remote learning? I think that, you know, there's really, the science is out on that. I know that the American Pediatric Academy has expressed concerns about the social emotional development of children, which I think are valid concerns. But what I also think is that children are very resilient, and their brains are very malleable. And so I think that looking at this time as an opportunity in both children as well as teenagers to help them learn some, you know, kind of, we were just talking about self-motivation, but learning some independent skills where they learn to set goals for themselves, where they learn to be curious, you know, encouraging them to be curious, modeling to them, encouraging them to be curious about learning. And then also that when you work with them in a collaborative way, you can help them meet a lot of the social emotional needs that would normally be met in a school setting. You can't, you know, replicate what it's like being part of a peer group of 8 kids, but you can help them work on what it's like to deal with frustration, to focus on the process as opposed to outcome. You know, let's work when we need to take breaks. Let's take breaks. You can work with them on taking the perspective of others, just regarding how they interact with other family members or how they interact with pets. You can help them learn to give themselves encouragement and talk kindly to themselves. These are the type of social emotional skills that you can work with them on, even though they're not in school. You can learn, how do you calm yourself when you're feeling stressed? You can do yoga or progressive muscle relaxation or belly breathing, taking walks. So allowing opportunities for play, allowing opportunities to learn some of these skills. Again, you can't fully replicate what they would get from the school, but I do think that there's opportunities for some cool bonding with your kids during this time. that also can help them develop some of these social emotional some of these social emotional skills that they're going to need as an adult. I have a question here that says, as I'm sure you know, there's a real shortage of psychiatrists that see children. His daughter is 7 in Lexington and who take insurance. UK, has a lot of psychiatrists, has written their contract. This parent says, at least with Aetna, so that they don't take insurance for outpatient. So it sounds like his insurance is not being accepted with UK outpatient psychiatry. If the primary insurance does not pay, then the secondary insurance also doesn't pay. So he was interested in where could you do some advocacy, or is there some way you could access an advocate? I think that if you are working with like UK outpatient psychiatry, one thing to always ask them is directly to ask them for referral sources, just on a practical level. With your own insurance provider, I think that that's a good place of contact if you want to do advocacy, is talk to a rep for your own insurance provider about the need for greater access to psychiatrists that accept this insurance. I also would just like to point out that there's a lot of children see psychiatric nurses who accept different insurance. There are also, in addition to UK, there are community mental health organizations like New Vista. My former employee was KVC Kentucky. They have a child psychiatrist as well as a psychiatric nurse. There's a lot of primary care settings that have psychiatric nurses on staff. There's other community organizations in Lexington like Beaumont Behavioral Health that have actually a pretty large staff of psychiatric nurses. So my experience is that often a psychiatric nurse can be as effective or even more effective than some psychiatrists, because this is just kind of anecdotal, but what I've observed is they tend to spend a little bit more time with the kids. But I think what I would encourage you to do is to really look for other community resources in this area, to talk with your insurance provider, both to advocate for the need for greater access to the services, but also to ask them, who within network accepts this insurance, so you know your full range of options. And I believe that is my final question. So I would again just like to thank you for joining us today. I hope that this presentation on how to know if your child needs to see a therapist or behavioral health professional, I hope this has been helpful. And again, if you ever want to schedule within Work-Life Connections, we do work with children as long as they are dependents of UK faculty and staff. So thank you for your time, and be well.